Hello everyone, I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. The topic of our lecture today about strategies for prevention of post-operative adhesion in gynecology, specifically, and in surgery as a general. Okay? Okay, what about these strategies to prevent adhesions? You can summarize into three main items. Meticulous surgical technique by reducing tissue trauma and use all the methods to prevent adhesions with better handling of tissue and so on and so on. So meticulous surgical technique is the first item and is the most important one. The second item is placing a physical barrier between peritoneal surfaces to prevent adhesions. The third item is the use of pharmacological agents to modulate the cellular response to tissue injury. Okay, so we have three main items in the strategies to prevent adhesion. Let us start with before I start, the first item. Surgeons should adopt routine adhesion reduction strategy in high-risk surgery specifically. In gynecology, what is the important surgery liable for adhesions? Ovarian surgery for ovarian cyst, so endometriosis surgery, myomectomy, tubal surgery. This is for example. Okay? Okay, let us go to the first important item in reduction of post-operative adhesions, which is meticulous surgical technique. First, use starch and latex-free gloves. Then, during operation, careful handling of tissue with field enhancement techniques. Try to reduce the duration of surgery and reduce risk of infection. Perform diligent hemostasis, reduce cautery time and frequency, and aspirate aerosolized tissue following cautery. Avoid excess fulguration also, because fulguration leads to adhesions. During laparoscopy, reduce pressure and duration of pneumoperitoneum. Also, reduce drying of tissue during laparotomy. Minimal use of dry towels, sponges in laparotomy. If you use towel, it should be moist. Be careful about this point. Use frequent irrigation and aspiration in laparoscopic and laparotomy surgery when needed. So irrigation and aspiration is important in prevention of adhesion. Limit use of sutures except when needed, and choose fine non-reactive sutures, those with monofilament, okay, non-reactive one. Avoid foreign bodies when possible, such as materials with loose fibers. Avoid non-peritonized implants and meshes. And lastly, the use of adhesion reduction agents when needed. Okay? The second important item in our strategy to prevent post-operative adhesion is the placing a physical barrier. But please remember that surgical barriers may help to decrease post-operative adhesion formation, but cannot compensate for poor surgical technique. So, good surgical technique is the most important factor. Okay? Okay. I repeat it because it is important. Please remember, surgical barrier may help to decrease postoperative adhesion formation, but cannot compensate for poor surgical technique. Also, I wanna give example for physical barrier. Modified sodium hyaluronic acid and carboxymethyl cellulose are combined in bioresorbable membrane called in the market Sebrafilm, Genzyme. Okay, this combination, the HA and CMC film, is a transparent and absorbable membrane that act to separate opposing tissue surfaces and lasts for 7 days. Being extended for 7 days is important because adhesions occur in the first few days after operation, especially the first 3 days or 3 to 5 days to be complete. So if I used barrier, should at least continue for 7 days. So one of the advantages of HA and CMC film, it lasts for 7 days. This is just one example for a physical barrier. So what about the ideal adhesion barrier? The ideal adhesion barrier achieves effective tissue separation, has a long half-life within the peritoneal cavity so that it can remain active during the critical 7-day peritoneal healing period, not promoting bacterial growth, and remains active and effective in the presence of blood. Also, not interfering with wound healing, and could be absorbed or metabolized without initiating a marked pro-inflammatory tissue response. This is the characters of the ideal adhesion barrier. We have here in this table and the next table many examples of adhesion prevention barriers like polylactic acid, like hyaluronic acid, like polyethylene glycol, and the mechanism of action of each one here. For example, hyaluronic acid, wound healing properties, high viscosity when dissolving by water or body fluid, mucoadhesive property in solid state, biocompatible and bioresorbable. Okay? Okay. The next table, you can also read different barriers like cellulose, like oxidized regenerated cellulose. What's the mechanism of action? Wound healing properties in terms of re-epithelialization, mucoadhesive property in solid state, biocompatible, bioresorbable. Also, we have an example of carboxymethyl cellulose. Okay, remained on the injury surfaces during wound healing, mucoadhesive property in solid state, delayed bioresorption, biocompatible. Icodextrin metabolized into oligosaccharides by the 3-O amylase in the body, delayed bioresorption in peritoneal cavity, remained on the injury surface during wound healing, and biocompatible. Okay, icodextrin 4%. Okay, let us go to the last item in the strategies of prevention of adhesions, which is the pharmacological agents. Unfortunately, none of them is efficient enough, like corticosteroid, like heparin, like antibiotic solution. Installation of corticosteroid like dexamethasone in the peritoneal cavity or heparin or antibiotic solutions doesn't prove to be effective in prevention of post-operative adhesion. For example, corticosteroid in a meta-analysis of 5 randomized controlled trials that investigated the efficacy of steroids in preventing adhesions showed that neither adhesion formation nor pregnancy rate improved, with the potential for an increased risk of infection in the perioperative setting. What about heparin? Studies that used heparin to prevent adhesion haven't shown benefit in reduction of peritoneal adhesion after pelvic surgery. What about antibiotic solution for peritoneal lavage and the prevention of post-operative infection? Studies showed that it doesn't reduce adhesion, and some may promote adhesion formation. Okay? By the way, I want to tell you about also crystalloid solution like saline, like Ringer's lactate, because many gynecologists using this crystalloid solution to fill the peritoneal cavity with this solution to prevent adhesions, aiming to prevent adhesion. However, it is not proved up till now that either saline, normal saline, or Ringer's lactate proved to prevent post-operative adhesion. So you should know this very well. So we have 3 strategies, as I said before: meticulated surgical technique, placing of a barrier to prevent adhesion, and lastly, pharmacological agent. And I said the most important is the meticulous surgical technique. This is the end of my lecture. I hope it was clear enough and targeted to the point. This is my books published on Amazon: Textbook of Obstetrics, Textbook of Gynecology, Contraception Handbook, and the Multiple Choice Question Book. By the way, I have another lecture for prevention of post-operative adhesion with more detail. You can find it on my YouTube channel on this link. Also, you can find my book on Amazon in this link, and another scientific site belongs to me on Blogspot in this link. Thank you, everybody. Wishing you the best.